I think that I would like to just, especially with you guys, just because some of the lingo to me is a little new, a little foreign, to kind of just go through the questions that you guys have already had, but you have presented to us via email, and then we'll go from there.
Sure. We didn't have any questions from the hearing.
Okay. Because I know that my co-chair has some questions, but for me, I feel we kind of went over everything pretty quickly.
Sure.
So if you want to just give him a little bit of time, unless Rep. Nolan has anything, because I know that we've talked about this a little bit before.
Hello, how's everybody doing?
Good.
Good to see you.
Sorry, I'm traveling up there now, so trying to look at my cheat sheet over there.
Okay.
I think one of the thank you, Mr. Chair. First, one of the things that I was curious about was the staffing levels. Where were they as far as the need, because of what the budget was looking like?
Well, our staffing levels were appropriated for 27. We have 23. We have one more coming in to make it 24. I did request in my testimony explain a little bit about the staffing. We could absolutely use staffing over here. I had a chart that I put in there that gave the levels of service that we do, because we service over, almost 100,000 members, 40,000 retirees, 55,000 active. What we could really use, to be very honest with you, is that we operate 2 medical retiree programs. When the state of Connecticut made their switch with the retirees, they moved them all into a Medicare Advantage. There were no options. The board felt that our retirees, we wanted to give them an option. So they had the Medicare Advantage program or the Medicare Supplement program. So now we're administering 2 programs, which are much more complex than the old self-funded Medicare Supplement plan that we had through Sterling. We've saved, 70 million on that alone, another 6. So there's the OPEB's down 30%. Everything's looking great. So we're very excited, but we're undertaking double the administration without any additional staff. So
what staff are you in need of? Which specific staff? I mean, I know you gave us some
Sure.
testimony, but without having it in front of me, could you just clarify that for those that are
Sure, absolutely. What we're, the retiree benefit programs impact fiscal and benefits because there's elements that involve both of those divisions. So what we were hoping for was possibly another retirement benefit officer. It's a higher level position. It's not a clerk. It's a person who really has to understand Medicare regulations, some accounting principles, billing, computer software. So with that position, the retirement benefit officer position, the way it's listed and the way it's just the specs for it it's so versatile that it would be great because we could cross this person over to work on the benefit side and the fiscal side. So it would just be an overall perfect position to help administer that retiree plan from both fiscal and benefits.
Okay, and what is the cost for that specifically?
The RBO starts at, correct me if I'm wrong, I think it's 68 or 69 a year.
Is that with the benefit package?
No, that's just the salary.
And what would it be with the benefit package?
I believe the benefit package is another 20 a year. I don't have the number. I don't have the cost breakdown as to what the benefit package is along with the salary. Locke might have that,
Yeah, I'm not quite sure on what the benefit package amount would be, but I'm looking up exactly how much that position would make for her salary. We also have the opportunity to open that position as a trainee as well. So we could some cost savings there. We've done that twice now with our new recently added RVO positions. We would start the first 2 years as a training program. Those started at $49 and allows the prospective employee train and see if they are something that we want to hold on to. So it kind of works out for everybody. But we look at what the final class would be.
Okay. I'm going to let others ask questions. Thank you, Mr. Chair.
Thank you, Rep. Nolan. Does anybody have any other questions?
Excuse me, I forgot to raise my hand here.
All right, Rep. McCarty,
Representative,
what you
thank
got?
you, Mr. Chairman. Thank you. Excuse me just for the moment. I just wondered, in reading your testimony, Ms. Sullivan, you mentioned about the technology, that upgrading technology. Would you just comment a little bit more about where you are with that plan?
I would absolutely, and thank you for bringing that up today. We have a 22-year-old software system. It's very antiquated. Again, we have been working, we started the process to invest and look at other options to upgrade that software system. If we stayed with our current vendor, the Pension Gold vendor, it was going to run up to 17 million a year. I mean, 17 million for the package, and then another 500,000 a year for, I can't think of the name off the top of my head. Not service fees, but to have us access that program, it would be, $500,000 a year and whatever contracting fees. So the conversation took a different turn, and we met with the core CT folks, and that option seemed much more viable, much more cost effective. They already have their retirees in there for MERS. So we would actually become a company, so to speak, into their program. It's got a lot of opportunity for us. We were looking at costs, and don't quote me because we were talking, 6 million, 7 million. We wouldn't know what the actual cost was going to be until we really got in there to do a complete evaluation. We did meet with the core team a couple of times to talk about, our software and how it could be compatible with their software. We did meet with Marty Carlson. We were setting up a meeting with OPM, and then the pandemic hit last March. So that was kind of put on the back burner. But we've made, we've done a high level overview of the software, and we're hoping to start those conversations again and get more into the details. We did hire another IT person because we do need another IT person because we're constantly patching what we have here. With all of the everything being so outdated and having to keep rewriting and fixing things. For example, we'll come up with a patch for our program, and then, Windows or Microsoft will come out with an upgrade, and it wipes out everything we did, and we have to do it over. And as things are becoming more and more technology advanced, our patches are no longer fitting. And I know that this administration is very IT proactive in technology, driven. So we're hoping this might be the opportunity for us to start negotiations and conversations again and get back into possibility of transitioning into core CT. And that process will take about 2 to 3 years to complete. It's not a simple, flip of a switch for us. I will be very candid. My concerns are if this system crashes, how are we getting pension checks out to our retired teachers? That is my fear. It would be a workaround, but it would be very impactful to that population should something happen to this system. Which is why we're pushing.
Okay, great. Thank you for that update. It's very helpful. Thank you.
Any other questions? Representative Kennedy.
Thank you, Mr. Chairman. Can you just clarify, Ms. Sullivan? It's a 22-year-old system. Is it still currently being serviced, or are you no longer able to be serviced?
We own the software outright. There is no servicing. It's our software. We maintain it ourselves. It's that outdated. And again, if we went with the new system with the vendor pension gold, we would have to be paying those servicing fees with them annually in addition to purchasing the service. So which is why we wanted to explore the core program, because there already is a retiree module there, and they're trying to transition to everything we want to do. We want to create that portal for the retirees to go in and get their information, for them to download, their annual statements, their EFTs, things that they need. So it's a two-way communication, because the retirees are becoming more and more computer savvy as well, especially that younger, when they're leaving teaching and becoming, Medicare eligible and retiring. So it would be a bonus for us to be able to work with, OSC and the treasurer and all be on the same system.
Okay, I appreciate that. Thank you very much. Thank you, Mr. Chairman.
Thank you. I'd like to jump in here for a second, just to piggyback off of that and ask, you talk about how the software is 22 years old. Where are you in terms of hardware? When is the last time you've had an update there?
Oh, great question. We are due to go into virtual servers for July 1st. Right now, the jury's out on that, because our software is so outdated and our versions of software are so outdated. We don't know if we're going to be able to move to a virtual server. So that's thank you for bringing that up. We're working on that now with the BEST team. Hopefully our version of Oracle will be compatible. If not, worst case, we'd be on our own with our servers until we were able to move and to upgrade our software. So we're really behind the 8 ball on everything.
Got it. But if you were to move to core, that problem wouldn't exist.
Correct.
Okay.
Correct.
Thank you. Representative Belinsky.
Thank you, Mr. Chairman. The comments about us being on our own and the fact that we're looking at a hardware software solution versus technology that's a little bit more nimble. Have we looked into moving some of these functions, or maybe all of these functions, to one of the insurance companies that manage these plans, all around Hartford for people all over the world? That way we wouldn't have the initial, potential expense of a $17 million outlay. And they would be responsible, because it's the way they do business, to just, do the continual upgrades in the software. So we'll never hit this, technology wall where we have a system that, just died with the dinosaurs. I see this as a really great opportunity for us to, become true administrators and allow the software, which already exists all around us, to be put to work, instead of us just throwing money into a system that we don't know how much longer we're going to keep it alive.
I'm unaware of any other insurance company that administers a pension system. I know we could, and I looked at outsourcing the healthcare piece for the retirees, because of the administrative burden on the agency. And I did an RFI just on that for that small population. And the RFI came back with just to administer and do like the daily billings and send out information to the carrier, to the members. We'd still have to have a stake in that, because we have to pull money from their pension checks. The RFI for that was between $700,000 and $800,000 a year, just to have a consulting firm for healthcare come in and help us administer that, which is why we wanted to do we just wanted to hire another staff member, because we still have to be involved, especially in our statutes as well. But I'll be very candid. I haven't looked at someone taking over our entire pension system.
They're out there. And I think that it's a question we should ask. Obviously, it's not something we're going to solve for this budget. but we should be looking into the future so that the next time we need to, to upgrade and, transition into new technology, that it doesn't become a burden to the state where we're fishing around for, people in, core CT and general administration agencies to actually learn and acquire a new technology that is going to be obsoleted in, maybe 12 to 24 months anyway.
Well, core CT is not going to be obsolete. That's what the state is using for all of their platforms. That's what the state of Connecticut uses to administer their pension checks to their retirees. It's the payroll system. So we'd be actually moving into the state of Connecticut payroll system.
Okay. All right. So we're not willing to look at outside solutions instead of
So if I could, I'm wondering, I'm sorry, Mr. Chair, whenever
Yes,
you get
Senator
a
Austin.
break. On the core system, there is no other system akin to the core system that provides the information to people through through a mechanism. This would also allow the Appropriations Committee to have the data necessary that we would have access to. That's how we get all our position counts and a lot of other things through Core CT. Just the functionality of that system is not like an insurance company. This is not an insurance. This does both the insurance and the payroll component of retired teachers, Representative Belinsky. So that would bifurcate what we have right now for a system relative to teachers for retiree health and their pension system. So as we control all the dollars, we would be then paying somebody else to do something that could be incorporated into a system that we already own. And we would have the ability to get data that we would not get from another outside the system. So I just wanted to put that out there, that this is not the same thing as an insurance policy. Thank you very much, Mr. Chair. Sorry for interrupting.
Oh, no, thank you for the clarification.
Yeah, so I'll conclude. I apologize for the misnomer of calling it an insurance product. I was only thinking one-dimensionally with it, but I do believe there are resources that we owe it to the taxpayers to look at. We might actually find a way to do it that is more efficient. And if we don't, then it doesn't hurt to look. That's all I have, Mr. Chairman. Thank you.
Thank you. And I see that my co-chair is on. If you wanted to get any of his questions into the Teachers Retirement Board, I'd like to give him that opportunity. Senator McCrory? You're muted, Senator.
Sorry, I'm in between meetings. I don't have any questions for the Retirement Board. I'm fine. Thank you.
Thank you. Representative Dathan.
Thank you very much, Mr. Chairman. Just a real quick question, Helen. Thank you for your presentation. Just wanted to see, with this system that you're talking about, are there other states that use this system, or
the pension, our current system?
No, what you're looking at, the new system. Are there other states using it, or other large retirement funds?
We would be part of the state of Connecticut core system.
Right. So there's no third-party software that I thought there was, or is that
there is a third-party software system, Pension Gold, that we currently have. And again, to upgrade our system, which would be the most cost-effective if we didn't go into core CT, because we'd be starting from scratch with a completely third-party administrator. So when we looked at moving into Pension Gold, which is just an upgrade, that would be 12 to 17 million. Mm-hmm. So if we were going to go to a complete shop out a new system entirely, I don't know what that cost would be, but it made the most sense to try and stick with our software, or even better, to get into core CT with our sister agencies.
Yeah,
And then
that
we'd all be on one platform, has Senator
Yeah.
Austin explained.
That's helpful. What I was wondering, has the agency ever had a look at the cost as a percentage of the total assets under management? I'm just wondering, to kind of satisfy Representative Belinsky's concern about cost. I mean, it would be interesting to know where our costs stack compared to other states in a pro rata. If there is any analytics that you guys have done so that we can show the taxpayers are getting a good value for their money. I don't know if you've thought through that or if you've worked through anything like that, but was just curious.
We don't have exact analytics on how, for example, assets under management, because the treasurer manages our assets. So the number that I have is for administrating our pension plan with current staff to simply do all the processing and get the checks ready to send out. Right now, for managing 100,000 members, it costs $20 per member for us to administer this plan.
$20 a year?
Correct.
Oh, wow. Okay. I mean, that would, look, that's really interesting. Do you have any comparable data for what other states pay per member?
I do not. We have seen or visited other state retirement systems and simply just compared staff levels versus number of members. And that itself is staggering when we compare it. But to have, I guess, comprehensive analytics to present, we haven't gotten that far.
No, I was just kind of curious because I think that's another approach to think about Rep. Belinsky's question, so that we can kind of compare on a pro rata, whether it's, cost per member. I like that analytic. Or, I think it's hard to look at staffing levels. It's easier to look at, an apples to apples type thing. So I appreciate the response. Thank you, Mr. Chairman.
Thank you. Are there any other questions? Okay.
I mean, in the scheme of things, when you look at what private sector companies do, upgrading their systems constantly, even if we went to a third party, we'd be subject to, again, not having that data, whatever system upgrades they're doing, we'd be paying for things probably twice. If you break it down, you think about it, and for 22 years not having an upgrade, $6 million is really not a lot of money. If we're looking at $6, $7, $8 million, because if we had done our upgrades all along, we'd be,
So since we have a little bit of time, indulge me in this rabbit hole I may bring us down for a second.
Okay.
In terms of security with that information, and cybersecurity overall, what exactly do you think are the pitfalls of going to an outside source rather than being in-house? Because I feel that there are probably many, and I'd like to.
I honestly don't think it'd be cost effective to go to a third party. Coming from that background before and coming into the state and knowing what the admin fees are and charges are, I could be way wrong. It's just I'm comparing it on the health side. So
right,
security.
But in terms of security.
I mean, there's always that risk. I mean, you don't know. We've seen situations, again, I'll refer it to the health side of the house, where you've seen those stories about data getting out. I know Anthem had an issue a couple of years ago. I believe United Healthcare did. There's always that risk of security. Being in-house, correct me if I'm wrong, I think we have a much tighter strain on our security because we're all in that one system and it's not going anywhere. It's all being maintained in one spot.
I think the state itself does a tremendous level with security efforts all across the board with DAS and the dedication they have towards putting the fronts up to protect taxpayer sensitive information. one of the benefits of working with in-house with the state is everything's in-house. We're transferring data on a secure network that's behind a firewall. Right now, we currently send files to the comptrollers to print our checks. That is on a secure network. And putting it on Core CT would just piggyback off that high level of security. Whereas working with a third party, we'd have to take the extra measures of establishing that secure connection, transferring that type of information back and forth.
Yeah, that was kind of what I was going for. I feel it would take a pretty significant cost savings for us to even consider that route. I just wanted to hear from you guys what you thought the pitfalls were. So thank you for that. One more time, are there any other questions? Seeing none, I thank you guys for being here. I'm glad to get the work started. So thank you.
Thank you very much.
Thank you all very much. Have a great day, everybody.
Thank you.
Thanks.
Helen,
Yes.
before you go, do
Yes,
you
ma'am.
want to give, because we've got some time before OEC joins us.
Okay.
Do you want to give the members of the subcommittee a brief overview of your legislative package, which we hope to be hearing on March 26th, so that
Sure.
they have some familiarity with it?
Absolutely. This package started out in 2019. It was a very comprehensive package. I came on board in 2018. My predecessor stayed on board and worked in conjunction with one of our attorneys to make some updates to the statutes, which in turn will assist with the regulations, which need to be updated. In 2014, we were cited by the auditors, the agency, as to having outdated regs. The easiest solution would be to start with the statutes, and then whatever falls array, we can deal with the regulations because they're much harder to change than the statutes. So we were moving along with our wonderful comprehensive package, and again, we had the pandemic hit in March of 2020. So we scaled it back, and so what we did was we picked the key elements that to submit for this legislation. And then we'd like to get the rest of the package in for next session. The reason that we scaled it back was because the package is so comprehensive and so many pieces of it, pitfall, if we're changing, for example, we want to rewrite how the benefit plans are explained. Well, when you rewrite that in one section, we have to address another section. And so it kind of piggybacks off each other. So rather than get into all of that, we figured we'd start small. I do have an overview. Locke, do you want to share your screen and I can just walk everybody through the overview? If that's okay. I wasn't sure how to share it in Zoom. I thought you might be more. He's much more tech savvy than me.
Can everyone see my screen? It's a Word doc of a summary.
Cannot see it yet.
All right.
There it is.
How about now? All right.
Thanks, Locke. This is just a brief summary. What we were going to plan on addressing were two definitions that really need clarification. One was regarding the disability application, and the other was for the formal application for disability. They were a little outdated. So we're just clarifying those in this package. That's under 10.183B in our definitions. And then in section 10.183F, there's benefit eligibility. And that is just updating the RMD, the required minimum distribution changed at the federal level. At the federal level, it's age 72. Our statutes indicate age 70. So we're going to update that. And we were also going to speak to Nick Bambici, who's assisting us. And we may want to reword that one a little bit so that if that RMD does change, we don't have to keep adjusting the statute. We can say we're going to follow federal guidelines regarding, RMD changes and things like that. So we're not have to keep going back in and out of that. So that's just really to clarify the federal RMD age 72. Then we were looking at our section 10.183I. It's called members' voluntary contributions limitations. We wanted to clarify that our members can make voluntary contributions and it has to be through payroll deduction post-tax. We wanted to just establish those perimeters and clarify that language. It has come up a couple of times. What we're doing is we're taking all the feedback and you know, and things that we get questions on, that really, if we just simply clarified the language, it'd be pretty much black and white for everybody. So we wouldn't fall into these rabbit holes or pitfalls about interpretation of language. Then we're moving to, we were looking at 10183L. And that was the retirement valuation of fund. There were two items that we wanted to clarify. We wanted to, currently it says that there has to be 6 members present to have a vote on the board. We've never gone below 6 members, but just in an effort to clarify that again, we wanted to add what a quorum was and just say that, you know, as long as we had a quorum, it could constitute a majority if we ever had a situation where there were less than 6 board members present. Again, it hasn't happened, but we just wanted to clarify that. We were also clarifying the title of my role, which is a little confusing. I'm listed as in the regulations as a chief administrator. I'm referred to as an administrator, but I'm a secretary. So the board wanted to find the appropriate title for me. I would say that I'm more of a division director, but we'd like to, you know, get that more up to date than it is. It's a little outdated. And then we were looking at section 10183P, which is credit for time served in other state systems. There is, you know what, can I have you clarify this one? Because you were in so many meetings with the comptroller's office. I don't want to put you on the spot.
Right. When we offer members the ability to combine or consolidate state-sponsored pension system or pension plans, we have some members out there that start off as state employees paying into either SERS or ARP, the alternative retirement plan. And then our statutes provide a mechanism for people to consolidate that time into our teachers' retirement system. The statutes as written lead those members to believe that they can just that they can transfer their money over, but federal guidelines prohibit members transferring employer contributions into a defined benefit plan. So there's a tough time where we're trying to convert a defined contribution plan into a defined benefit, and ARP is a type of defined contribution plan. So we're trying to tighten up that language and explain or have the statutes be flexible enough to adhere to federal guidelines when converting from a DC plan to a DB plan.
Thanks, Locke. Section 10V was reemployment of teachers. I'm not sure if any of this pocket of legislation has heard. There's the 45% rule where people can go back and they can earn up to 45% of their salary. What we'd like to do is, it's very difficult for us to police. Again, there's 22, 23, and 100,000 members if you look at the whole population. And we do have language out there. We do work with the boards. We wanted to clarify that when we find members who have exceeded this 45% rule, this statute gives us the ability to go ahead and try and get the repayment of funds back into the system. And it gives us a mechanism to do some sort of recoupment when it comes to folks who have violated that 45% rule.
Question for you.
Yes.
I have a question, Helen.
Sure.
Can you hear me?
Yep.
Did we make modifications to this 45% rule because of COVID when we wanted to try to get more teachers back into the system? Did we change the requirements?
No, we did not change the requirements. Teachers are really not trying to get back into the system.
No. I don't think that. I'm not saying overall. I said before, because of COVID, I know there was a large push to get retired teachers to come back into the system, and I think we offered some incentive. Has any of that been factored in?
No. When the executive order came out last April, we went to OPM and that executive order did not apply to education. We met with the Board of Education and we had a joint memo that we put together and sent out to all the districts to give them some options about this post 45% during COVID. I can't speak for anybody, but there were a few administrators who had an issue with this, post 45 rule. Keep in mind, you can earn up to 4 months of your salary, which is almost half of it. And then they can stop their pension and get their full salary. But with everything that happened and everything that's been moving forward, there's been no push for it. And I think we're coming out of the woods with it. So again, it was just a few administrators that we were aware of who wanted to push this. We didn't have any,
You say push it. When you say push it, what does that mean? Increase the percentage?
Yeah, they were trying to waive this post 45% rule.
And receive full pay?
Yes, and full pension. So I think we had a good handle on it. We worked with the Board of Education. We've worked with the unions. We really had our foot soldiers out there. We have great communication with CEA and AFT. So I think we're okay with the COVID situation right now with everything changing and everything that we've done so positively in the state. Again, we just, there are times when the rule is we find out about folks who have violated this rule, and this just gives us a way to recoup that money, so to speak.
Okay.
If you can call me anytime to talk about that one. I'm all ears, so feel free if I can answer any more questions. The next section was 1083Y, and that appeal to the board for reconsideration. We follow all of our state statutes and regulations, and as you know, some of them that we're trying to update and make a little more clear, more black and white, and get rid of that room for interpretation. So we wanted to just update our appeal process as well and provide some guidelines, regarding the appeal process. So we have rewritten that section where now, people just can't say, hey, I'm appealing this and, I want to speak in front of the board. There are rules, there are regulations. So now if someone is going to apply to the board for a reconsideration, like the member has to actually cite what the agency is not in compliance with statutorily. Many people, as you know, don't like the answer no, or they feel, we just want to make it very clear on how the appeal process works. They really need to cite what the agency is not in compliance with regarding their particular situation. Purchase of service credit is purchase of service credit. There are guidelines. Sometimes people, have a case where they feel that, their situation's outside of the box. 9 times out of 10, it's really not outside of the box. It's just understanding how the statutes and regulations work. 10183AA is our disability allowance. And we've always had a 3-month extension for someone to apply for disability because we understand they may be sick. There may be a delay in their applying for their disability application while they're an active member. So we just rewrote this to make it clearer so that people actually understood they have a 3-month, you have that 3-month window. If someone, is in a situation where they're hospitalized and they can't reach out, we felt that 90 days overall. By 90 days, generally, someone is going to step in or there's going to be a process in place. So that's always been in that disability allowance, but we just wanted to make it clearer, to be honest with you, so that people understood, as an active member of the system, if something, they're in a situation where they're unable to reach out, they have a 3-month window to reach out.
On this section, is there something in place for a family member to apply on the behalf of those that would be in, say, a coma? Because obviously sometimes comas last a little more than 3 months.
There is nothing for a family member to be in place, but There is what's called power of attorney, power of health attorney.
Yeah.
So generally we honor those, we do see a lot of power of attorneys with our population and our retirement. So there is a health power of attorney as well that we do honor. I mean, that's something we could that's a great idea. I absolutely can take that back to Nick and maybe we can tweak it, and put something in there, if you are incapacitated, please have your your power of attorney on the health side, reach out to us. So that's a nice takeaway. So thank you, Representative Felipe. And then lastly, we have a rollover account that we needed to really put some guidelines in and make sure that we were following how we accepted rollovers into the system. And we established some parameters where, someone submits that retiree application, they have 60 days to do their pre-tax rollover into the account. We have to follow all, federal guidelines. So we just wanted to clarify a couple of things with the rollover account to make it clear, so that people actually understood. There are parameters when you do a rollover. You just can't send a rollover here and let it sit here and accumulate interest. It's got to be at your time of retirement. You have 60 days, and there are certain things that members must do when they want to put money into their rollover account when they're retiring. So that is quite a big chunk that we're putting in for this year. And then I was hoping maybe even on the off season, if we even had a couple of meetings, I'd love to revisit the other sections of the statutes, maybe in piecemeal here, and just to get everybody up to speed. I know Representative Horn was working with us, and now I believe she's on another committee. So we did make some good strides last year, but again, with the pandemic and things changing, we sort of took a step back to try and put in what we could put in this year, and then put the rest in for next year. Once we're done, and once we're able to get all of our statutes updated, it will self-correct some of those regulations, as I mentioned earlier, that the auditors picked out in 2014. We will have some regulations to address, but it will be much easier with all of these changes at the statutory level. So that's where we are.
Thank you. Are there any further questions? Does anybody have a question on any of the sections that we've seen here? I do not see any.
Representative.
Oh, there you go.
Yeah,
Sure.
I just
McCarty.
want to ask Helen, no, I appreciate very much the overview and all the changes and the clarifications. I think it's great. Are we going to receive this document? Are we going to get this in advance?
Sure, I can send that this overview to you as well. I know that we are working on the draft. So once we have the draft, I will make sure that we send over the draft to you as well. Again, there's a couple of things we were tweaking when we started reaching out and working with Nick. So we'll be up to speed.
Yeah. And then
I'll send that right over to you. It's just my chicken scratch of, here's the condensed version of what we'd like to hit upon this, this session. So absolutely, we'll send it right over.
Thank you so much. And then Representative Felipe, if I may, I'm going to leave and then try to reconnect from my car. So I hope you'll be patient with me, but I'm going to leave now. And I thank the TRB for the presentation this morning. Thank you.
Thank you. Thank you all for attending. Thanks all for the great questions, suggestions, takeaways. At the end of the day, we just want to provide service to our members, the best that we possibly can.
And Rep. McCarty read my mind a little bit on getting this sent to us, but also if you have something a little more comprehensive that may give us, the language without having to look it up, that'd be great as well. For those of us that are a little more nerdy and want to look at the policy a little
Sure.
closer.
As soon as we have that final draft, I'll make sure I shoot it over to you. Absolutely.
Thank you.
Of course.
Anybody else? I'm sorry, my participants thing is in the middle here because of the screen share. I don't see anybody.
Okay.
So
We can take off the screen share.
yeah. So I just want to thank you guys for joining us and the presentation. I also want to thank Madam Administrator for asking for the presentation. It was very helpful. And I hope you guys have a good rest of your day.
Thank you very much. You too. Thank you.
Nice smooth meeting.
Yes, Madam Administrator, it seems Helen's having a hard time. You mind just, we don't want to be rude, but you mind if we kick her?
You can kick me. I didn't realize I was still there, guys. Sorry about that.
No problem.
There you go. Sorry.
Representative, it's Chris Perlo from OFA. Sue Keen got kicked off, so I'm kind of being the host for the, I work in OFA. I'm going to be the host for the next group that comes in.
Sure. Are they here, or are we just gonna?
I see one person here so far. Do you want me to let them in, or do you want to wait?
Commissioner with them?
I think it's their, I believe it's their liaison, maybe. I do not believe it's the commissioner.
This is early childhood.
Yes.
This is Beth. She's up at 11 o'clock.
Yes.
Yeah, it looks like who's up. Oh, I'm gonna let Emily in, who's an OFA staffer, and then Emily can maybe help me with some of the names of these people.
Okay.
Because I don't know all the staff in OEC.
Yeah, I'm gonna jump off for a minute and jump back on when I get into the office.
All right, Rep.
Hey, Emily, can you hear me?
Yep.
So I'm gonna, Sue Keen lost power at her house, so she got bounced from being host. So I'm helping her with hosting. So Maggie Adar, is that somebody let in?
Yep, Maggie Adair, she's in.
And then how about Chris Liddy?
Yep.
Okay, Representative, you want these people to come in now?
What do you think, Mr. Co-Chair?
I have to jump to another meeting.
Okay.
I would say let them come in, and I'll jump back over here in like 10, 12 minutes. But
right.
you can begin with them. I'm gonna have a couple of questions for early childhood. So yeah, why don't we let them in? Let's get beginning. But I got to jump over to another meeting right now, and I'll be back.
All right.
Okay, so I just let in 2 OEC staffers.
Mr. Liddy has a very colorful name there on his Zoom.
How you doing, Rep?
Good. How are you guys?
Very well, thank you.
Glad to see you. So I figured we could get started a bit if you guys would like to just go through some of what you sent us this morning, and then we could get rolling from there.
That sounds great. So we're going to wait for Commissioner Bai.
Absolutely. And I know that we have Senator McCrory is going to jump, but he'll come back and he'll have some questions, as well as Representative Walker, who's on our way up to the Capitol.
Super.
You know, I always thought it was the people. I always thought it was the buzz of this building, but there's just something about being back here, I gotta say. It makes you feel a little better.
Yeah, I bet.
A little tinge of normalcy. I've been one of these folks that's falling into the hole of, you know, kind of seeing the end, but not quite seeing the end. So I hope everybody else is having positive experiences these days. And I see that the commissioner is here. So I'd like to kick it over to her if I can.
Oh, good morning.
Good morning. How are you?
You're ready early for me?
Absolutely.
Awesome. Happy to be here. Do you want me to, I don't know how you're proceeding. I know last time you just wanted to ask questions. This time, do you want me to go over our answers and
So
then?
I
answer
just
questions?
had expressed to your staff, maybe we go over answers first to kind of give us a
Sure.
base, and then we'll get kicking with questions.
Sure. The first question was the COVID programs and spending and the amount and the funding. So there are now 3 buckets of COVID funding. The first was the CARES, which you'll find in answer 3, where Connecticut received $23,504,000. And we have spent 97% of this, most of it going to grants to providers to help preserve infrastructure. But we also had, other ways that we spent the funds that are detailed. We used some of it to support childcare programs that we're supporting frontline workers and items like that as well through our Connecticut CARES programs. I'm happy to get into more detail if you have other questions. The second round of funding is about $70 million that Connecticut has received in the CRRSA, the Corona Relief Funds. That was passed in December. We received the money in February. We got approval for how to spend the money from the feds about a week and a half ago. Now the governor approved the plan as well, and that the majority of that will also go out in the form of grants to providers. And we are finalizing the formula, but it will have an equity lens, adapting the amount of funds going to what you might call priority districts or distressed municipalities receiving more, or might not be a municipality, it might be a small town that has a lot of low-income families and very little supply. So those will be mostly going out in grants. Another part of it, the governor announced Friday, where we will be paying parent fees for families on Care for Kids from April through September. So that is depending on the size of the family who qualifies for Care for Kids. The entry point currently is 50% of the state median income, which for a family of 4 is about $60,000. And then it goes down based on the size of the family in terms of the income eligibility for Care for Kids. That is the second tranche of funds. And then Connecticut has not yet received guidance, but we do know from the legislation that Connecticut will receive $274 million to be used for childcare, both to preserve the infrastructure, that is grants to programs again. And the second part of that will be, funding for quality, funding for so parents can better afford childcare, and things like workforce development childcare funding, which we also have in the second tranche, some workforce development childcare funding, both to help our own workforce, but also to help people who are trying to get back on their feet and maybe in workforce training. Connecticut, without these funds, we're one of 3 states that does not allow parents into the subsidy program when they are participating in job training or adult ed or certificate programs or higher ed. We're able to cover some of those costs with these relief funds. So that's the first question.
Yeah, do you mind if I stop there and
Yeah,
let
sure, we
people
can
ask
go one at a
questions in that small
Absolutely.
pocket, because I know Senator
Absolutely.
Austin has a question. Senator Austin?
Sure.
Thank you very much, Mr. Chair. And I appreciate you stopping on this particular component of it. So my understanding is that the American Rescue Plan has a section in it that's direct payment to people who have small children under school age, $300 a week and $250 above that. Do you know how that is working?
So that is, that's not under our purview, but I do know how that's working. That is a child tax credit. And basically any family, I think it's 90% of families will qualify. They get $300 a child. And then I believe at age 6, it becomes $250 a child. and it's direct payments to the families versus waiting for the end of the year and taxes.
On a
So that's
weekly
really to
basis?
help families.
Excuse me,
Pardon?
I'm sorry. I'm sorry. On a weekly basis? Is that on a weekly basis or is that on a
It's a
bi-weekly? or-
monthly basis, I believe, but
So
that's
it's,
my understanding.
okay, I'm
It's a-
sorry.
It's a month.
I don't mean to interrupt. I have a, is that going to be considered as income?
Well, I believe, and again, I'm not the expert on this, and probably OFA can talk to this, but I do know from our own work where when we've been trying to give providers relief, sometimes they lose benefits because of it.
Correct.
I know that the only way around that is to structure it as a tax credit. And I know that this is structured as a tax credit versus income. So
Okay.
you know, Emily may know more than I do, but that's my understanding. And I think that's why it's structured that way.
This is sort of like one of the key components of things that we have that I think is going on vis-a-vis childcare. So somebody gets childcare, they get this tax credit, this additional dollars. Is that going to impact their children being in Head Start or any other early childhood program? Is that going to impact them having to pay those dollars into that program? How is that structured? Do we know yet?
That is a great question, Senator Austin, and we can look for guidance from the Office of Head Start. But my understanding of it from calls with other commissioners from around the country is that because it's structured as a tax credit, it is not income. And when we try to see who qualifies for Care for Kids or school readiness or Head Start, it's done by parents' income. It doesn't take into account any tax credit the parent may get. And I think that's an important point. We need to verify that.
Correct. And I think we need to verify whether it's a monthly, a weekly, bi-weekly, or monthly credit for people. I
I
think
believe
that's
it's monthly.
somebody else said monthly too, I think. Okay, that's what, because I'm really very interested in trying to figure out that that component of childcare. Thank you. Thank you, Mr. Chair.
Thank you. Any other questions on the COVID relief funding for the Office of Early Childhood? All right.
There are a
We're
couple
good for you.
questions. It looks like Senator McCrory and Representative Candelaria have their hands up.
Okay. Rep. Candelaria.
Thank you, Mr. Chairman. Just a quick question on the $70 million of the recovery funds. You mentioned that the plan has been approved by the governor. The grant will go to providers. To which specific providers? Will that also apply to home care centers?
Yeah, that's a great question. Any licensed provider, which does include licensed family child care homes and center-based. It also will include license exempt programs that go through licensing because they accept Care for Kids, which again keeps the dollars in the communities very often that may need the support more than other communities. I think every parent in Connecticut can use help with childcare and needs childcare infrastructure, but those grants are meant to protect childcare infrastructure in places where it's most at risk.
Okay, so it's for infrastructure. Okay.
Well, for operational costs really, Representative, because childcare providers and family childcare homes have really lost a lot of revenue during the pandemic and are struggling to stay afloat. And that's what the dollars were designed to help.
And when will that be rolled out?
March 31st, the application will roll out. And then right now we are actually enrolling people to become state vendors if they're not already state vendors to make it roll out more smoothly. So United Way is working with us right now for any providers who aren't vendors to be ready for the application, to get their state ID, and then March 31st, the grants will roll out.
Okay. Now, the parent fee, you mentioned from April to September, that will be whatever that amount is for the parent fee. That's what's being covered under these funds, correct?
Yes, that's from these funds. It's about $8 million.
Or is there a limit, Commissioner, on the amount?
No, it's whatever the parent's fee is as determined by Care for Kids. The more you make, the higher your fee. But every family has some share because you have to be working to get Care for Kids in Connecticut right now.
Now, you also were mentioning $274 million funding. You also talked about workforce development. Can you just explain a little bit more about those funds and what can those funds be utilized for? Sure.
The governor asked us to make sure we set aside some funding out of the 70 million into workforce development. He asked us, we had about $1 million, we've increased it to 3 million. Those dollars are going to go to expand what are some existing childcare options for families that are in certificate programs and workforce development programs at our community colleges. Some colleges have the campus program. We're looking to expand those. A lot of college campuses have SNAP education and training programs in place, and childcare is an option there. So we'll look to expand there. And that's the most flexible childcare option where students can access those. And then we'll be working to, with the higher ed lab schools to make sure they're serving students as they attend, and also that they're also helping expand the number of childcare workers. Okay. And then the next round we'll be looking at the 270 million is where we'll be looking to support Care for Kids for certain sectors of workforce development. It'll depend on, the distribution, but we are looking to use funds for that purpose.
All right. Thank you so much, Commissioner. Thank you, Mr. Chairman.
Thank you, Rep. Candelaria. I think that Senator McCrory was on another meeting, but I'm not sure if he had anything to add on this particular topic. Senator McCrory? Okay.
The second question is about Smart Start funding by source and purpose. I'm going to give a general overview of Smart Start, and then I'm going to ask Sarah Poulin from my office, who's been doing research with OPM on this question of Senator Austin's, because there are multiple parts of it. Smart Start is a program funded to expand preschool by offering communities funding for preschool. So if a public school wanted, when this program was open, it's been funding the same programs now for several years. But the idea was that the state of Connecticut would put up $75,000 a year in operating funds for a public preschool, and the public school would pay the rest of the costs to run it. But as a program was constructed, the schools said, we need help updating our sinks and bathrooms, et cetera. So we need funding for this. So programs also get up to $75,000 in capital dollars to help develop preschool classrooms. So that's how the program was structured. It was initially funded through the tobacco settlement funds, where some funds would go into bonding and some to operations to pay. And the original idea was to get to $10 million, but at $3.5 million, there were some difficult financial times, and it sort of stopped growing at $3.5 million, and it came back onto the appropriated budget. But the bond funds from that initial startup have remained, parts of them. So I'm going to ask Sarah to explain it, the more details of what funds are where right now. So Sarah, thank you.
Hi. So we have, like Commissioner Bai just said, we have had some changes in our funding structure for Smart Start program. It initially was the operations was initially through the tobacco settlement fund, and the the facilities, their capital bonding or grants were through the State Bond Commission. It was initially at 105 million in the aggregate for the whole program through 2024. but with some of the changes, it was reduced down to 63 million through the bond commission. Then we had some changes where the tobacco settlement fund was introduced as a
Did you say
funding source.
63 million in bonding?
Yes. So it was at 105, and then in fiscal year 2018, the funding sources were realigned. And so that was reduced from the amount that was authorized through the bond commission down to 63 million through fiscal year 24. I know there's a lot of numbers I'm like throwing out right now. But so in 2017, we had tobacco settlement funds that were funding the operations of Smart Start. Then also in 2018, that was realigned how the tobacco settlement funds were dispersed, was realigned so that now that is a general fund appropriation. We still have some tobacco settlement funds on hand, but we also have a general fund line item now for Smart Start, which is the 3.3 million. But we have 520,000 left on hand from tobacco settlement funds for the purpose of operations, which is to fund the slots for each classroom. And then we have 359,000 currently on our books from bond funds, like that remained from the capital grant. So that was to improve the classrooms. There's still 30 million to this point that have been authorized by through the bond bill, but we haven't gone to the bond commission to say that, we'd like more authorized to the agency at this point, because we haven't, opened the program back up. So I know that was a lot of jumping around. I don't know if anyone wants me to clarify anything specifically.
No, Sarah, I think what you're saying is there were some dollars set aside that are at OPM now as part of bonding, but that what OEC has is the 520,000 on hand. That's it for operating, and 359 on hand for bond funding. If we opened up Smart Start and school district wanted to add preschools, those dollars would be available to make renovations up to $75,000 per classroom.
Correct.
Just to summarize.
Yeah, what's on hand, correct, yeah.
What's on hand.
All right, any questions for this particular question?
I have a question, but give me 1 minute. I gotta vote in a second.
Absolutely. Well, let's just indulge Senator McCrory for a second while he votes. Actually, while we wait, Rep. Nolan, I know that you had some COVID funding related questions, but you came on after we got to that question. So if you wanted to jump in here, that'd be great too. Oh, Senator McCrory.
Yeah, so just for a clarification purpose, I'm familiar with the name Smart Start, but I'm not that versed in the program. Commissioner, what communities or any community is available for a Smart Start program? Is there any restriction on where can these programs be available?
Yes, the legislation is written in a way that is looking to prioritize communities that are serving kids who otherwise wouldn't have access to preschool. In their application, they have to show in a needs assessment as well that the community needs additional preschool capacity. I may ask Maggie I know Maggie, you and I were just talking about this yesterday, if you want to add in about that priority for communities serving children from low-income families.
Yes, from what the original legislation, it doesn't require, but it really encourages communities to prioritize lower-income families, and that is part of the RFP process. So most communities really, that is their priority, and that's what they want to focus on.
And while we're speaking, I'm sure I can get you a list of the communities that are served by Smart Start. I know Bridgeport has a whole lot of classrooms. It really depended on, sometimes it would depend if the district had a lot of community-based school readiness and the schools weren't using the school readiness funds, this was a way that the schools could add preschool capacity in the community at half the price. Because the idea is the state pays half, the city pays half, or the town pays half. And it also reached some communities that school readiness didn't reach.
Is the program being utilized to its capacity, do you believe?
No, no, we're going to look at this next round of coronavirus funding to see if there are ways. We have a survey out to districts right now to say, would you use this funding if it was available, so we can gauge demand, and then we'll know more as we develop our coronavirus relief plan. Now, we only have 2 years of funding, but some districts may say, we're in a really difficult time right now for kids and families, and we would like to add a preschool classroom or two. In most cases, it's funding like 2 to 3 classrooms in a district, you know, because a district may have a special ed preschool already going. They may have school readiness classrooms. It's just a way to expand a bit. But it's been closed off because of the appropriation. And this is a way to expand preschool access where the state pays less because the communities also have to chip in. And I'll ask my team to put the communities in the chat who receive it. Like they're parts of the state.
It's on our website, but I don't think we have a chat in this. Are we allowed to have a chat in this?
No, we're not allowed to have a chat because of
I will send the link to Sue Keen and she'll share it with you. It's right on our website, lists all the communities and how much funding they get.
Okay.
Thank you, Maggie.
And my last question, I'm good. Okay, that's fine. I would love to see that data. I just want to make sure the program is still functioning the way you want it to, and it's expanding. Because if it's not,
it's functioning.
You might want to do something different. I know there's a large demand in some communities for pre-K, but in some communities, I know you may seem like there's a need, but it's really not, because there's so many other organizations that's doing the work, and I don't want to see those other communities who might need this program not benefit from it. So I appreciate it. I'll wait for the email and see what it looks like. Thank you.
Senator, I'd just like to speak to that because the point you're making is exactly why this program was designed. It is. The idea is in some communities, they're all set for preschool capacity. You know, like Hartford, because it has a lot of great nonprofits, it's got a lot of magnet schools, like they're pretty good for preschool capacity. But there are other communities, and particularly in some of the more rural parts of the state, where they don't have many private preschools or other options. And this gives the districts, and in fact, that part of the state took advantage of this. So the idea is we have existing high quality programs. We want them to stay in business. But in places where there's still issues of preschool capacity and the public schools have an interest in helping with that, this is a great program because they pay half, we pay half, and you can serve kids with high quality care.
All right. Any other questions pertaining to this or the previous question for coronavirus funding? I see Rep. Nolan has his physical hand up.
Thank you, Mr. Chair. Senator McCrory actually bit into what I was wanting to talk about, and that would be for the incoming funding from the CARES Act. Where will we be heightening the abilities of the programs that are out there? So I was wondering, one, if you can share with everybody what the potential funding is, and then how we were going to exercise the move to better the abilities for these programs.
Yes, thank you, Representative Nolan. The money is really intended to help existing childcare programs, and that is where the bulk of the dollars will go, both in the current and the next coronavirus relief. We have to get, as I think we've talked about this, you know, we have programs are barely holding on, and you know, the governor's challenge is how can we help make the market work here, because it's not been working, and we know it's the lowest paid profession out there. So these dollars really give us an opportunity to look at our subsidy system, you know, to look at things like the parent fees, which we did here, but what families get in. Right now, Connecticut's at 50% of the state median income for access, and you can stay on until 65% of the state median income to allow you to get raises and not lose your childcare in the minute. But we can look at items like that. The governor wants us to think about how do we make childcare more affordable for families, and how do we help those childcare programs who've been open through the pandemic but losing money every month. Half of Connecticut childcare providers report that they put expenses to stay open on their personal credit cards during this pandemic. So they have been sacrificing a tremendous amount. And so we really need to prioritize, and that's the intent of the legislation, to support those providers. It's also a chance for things like workforce development childcare, because we know a lot of people have been displaced from their jobs and they can't get to workforce training if they don't have childcare. How do we remove those barriers? Some of the work that many of you, I know Representative Walker sits on the Governor's Workforce Council. We can do a better job of child screenings with more funding, so that we can reach more children at risk. So items like that, and I'm happy to, as you would prefer, and as this is developed, to come and, receive feedback from legislators on the plan.
I think that would be great. And you touched on something that I did get some concerns about is parent fees and getting help with funding and it affecting benefits. What actually do either we need to do or is there being done in regards to ensure that that doesn't happen, where the benefits get attacked just because they get assistance with that funding?
Representative, I don't have a simple answer for you on that one. During this coronavirus, during the last funding, as we expected, just about every program we're offering them money, just take the money. We know you have extra operating expenses, very simple application. This issue of benefit cliffs that you talk about came up, and some programs turned down funding. Some small family childcare homes were worried about losing, their health care or their housing certificate, et cetera. So we did meet with DSS and talk with them, because you might have seen the governor issued an executive order to say that, we don't want this to count against benefit cliffs. So, but the issue is federal rules around what counts as income. So we have to work with the feds to try to address that concern. It affects centers, but my concern is in Connecticut, we've been investing and focused on expanding family childcare homes, because we think that parents are looking for flexible schedules now often. We have to make sure we have infant toddler care, but this impacts those small women-owned businesses more than other businesses. So we are looking into this, but it is a problem. I don't know if the 2Gen workforce is doing works on benefit cliffs, and there may be ways to get involved there to try to resolve this.
Okay. If you have any recommendations in regards to language or anything that we can use to talk to our colleagues on the federal side, please feel free to send us that information, and we'll work real hard to try and close that door so that that can't happen in regards to benefits being attacked just because of some assistance from other areas. It just doesn't make sense that they would lose out just because they got assistance that is needed for these situations. So I appreciate you and all the work that your team is doing. And thank you, Mr. Chair. That's my question for now.
Thank you, Representative.
Thank you, Representative Nolan. And I see that we're running low on time. So, and there are 7 questions left to get to. So if we could run through the next few.
Sure. There were questions about the birth to 3 caseload. So between June 1st, 2020 and January 31st, 2021, the birth to 3 system supported the provision of early intervention services to the families of 10,914 children. And then as opposed to June 1st, 2019 to May 31st, 2020, which would be June till the end of May, that was 14,000. And the year before that, it was a little over, it was 14,800. The year after that, before that was 15,235. And it was around 14,000 in 17-18. So we know we have a reduced caseload in birth to 3, and we do anticipate a big uptick when schools reopen and preschools reopen and kids return. So this is a area of concern. Any questions on that? Okay, so I'll go on to state Head Start and caseload data. You have it in front of you. The total funded capacity for 2020 for state Head Start was 228 new spaces in 14 communities. Know that this is state funding on top of the federal funding. The vast majority of Head Start funding is federal. These are ways the state has said we want to enhance and expand that. State Head Start Innovative Enhancement Grants added 895 extended day, extended year preschool spaces. So that's to allow Head Start to go to full day, because most Head Start is part day in 23 communities. Also added some preschool spaces. Total capacity for 2021 was essentially the same. These grants are also used to enhance literacy and curriculum and help dual language learners and behavioral health supports. COVID-19 resulted in program closures, so this did affect enrollment. So that's my reply on state Head Start and caseload. I'm happy to answer any questions you have about that.
Cost to build that
Absolutely.
project.
Senator Austin.
Thank you very much, Mr. Chair. So you said it was state dollars, Commissioner. So I'm curious, is that state dollars or is that federal dollars that the state has the opportunity to put out there, or where is that state dollars coming from?
They are, Head Start is primarily funded by federal funds, right, but the state has some programs that help enhance that, if you will. They add on to the day because Head Start's part day, but parents are working and need full day. And they also create some spaces as well. So it's a way just to add capacity to the federal capacity.
That I understand. Where did the state get the money from?
It's the general appropriation.
So that is,
and this is money they've had in the general fund all the time that was just not being used?
No, it is mostly being used most years, but there was a decline in caseload last year. Part of that was
toward the area which encompasses Representative Baker's, Representative Felipe's in my district, and I know we're talking about TOD projects.
Oh, I'm sorry, it's me because
you're not on mute.
Okay, sorry, Kathy. Sorry, Senator.
No, I'm okay with that. I have another Zoom going on, so yeah, I always forget how loud it is on the other side.
I'm so glad I couldn't be in two places at once when I was there. But basically, there was a transition of a program to a new, it moved from CRT to CREC, the Head Start. And so there was a period of time during which they weren't funded. So there was reduced utilization last year.
So did they use this as a carry forward, or where did the dollars come from? Because now that we're back up, it makes sense that the program will be used at what would have been its yearly usage. So is this carry forward dollars that we're using?
Well, right now there's just a cut, so that cut would be felt across programs.
I guess I'm misunderstanding then. We're doing this new program because the governor found a pot of dollars that weren't being used, and they weren't being used because we were in COVID, but we're coming out of COVID. So this is about next year's budget. So is the money being carried forward that we didn't use in 20
Oh,
and
in
21?
this program, no, that was not the decision that was made. There was a cut to the program.
So where does the money come from that the governor is putting in this new program?
Well, this is not a new program. This is a program that's existed to fund Head Start sort of extension to add on to Head Start.
Yep.
So the federal spaces would still be there, but some of the items like the extended day would serve fewer children. That this is a cut to the program.
I thought you said that the state was adding on money for, did I miss something?
Well, with,
entirely possible, because when I'm moving from meeting to meeting, I may be missing, but didn't you just say the state was giving more money for?
Well, I was using that to explain that we get the Head Start funds.
Yep.
And then the state uses its appropriation to add funds to extend the day and serve more children.
Okay.
Extended day services.
Okay,
but that has been cut some here in this budget.
So the governor's not adding additional money in for this? No. Okay, no. Thank you.
You're welcome.
Thank you, Mr. Chair.
I don't see any other questions, so we can go on to the next one.
The next one, number 5, hopefully you have the pie charts in front of you that explain how we're spending our quality improvement dollars. I know this question arose because there have been cuts to the quality enhancement line item. I would say that we really feel confident that the preschool development grants and the changes in CCDF rules around how much you need to spend on quality improvement, which is our federal bucket of dollars for Care for Kids, that we will be able to provide the same level of services. In fact, we're spending significantly more on quality overall when you account for the federal dollars on quality improvement. I checked with my director here, and we also know there, on top of the American Rescue Plan dollars for grants to childcare programs, there's also a 10% set aside that can be used for quality as well. But even take that out, because we just have additional federal dollars over the past several years that are required to be spent on quality improvement. And we believe that this cut we can manage, and we will be providing more quality support than ever before in the coming 2 years.
To that point, are we leading ourselves towards a cliff? Is there going to be a need to reintroduce state money into the budget for quality coming out of this time?
I so appreciate that question, Representative. I think that is the question we're all wrestling with here. The federal dollars that I'm talking about that have been assigned to quality are built into the base of the CCDF grant. So before this happened, you all may remember that last year there was an additional $14 million for child care services. But there have been some structural changes in the federal child care grant that assign an additional proportion of the dollars that need to be spent on quality initiatives. So in this case, not so much, but when we talk about changes to the certificate program to say allow more families in or to improve the market rate, we do need to be thinking about cliffs. At the same time that we think about this sort of once in a century opportunity to think about how do we improve access and quality to childcare.
And some of the improvements that you're making are some of them, one-time improvements where you start now, make a payment, and that really carries forward into the next 10, 15 years.
Some are, but we are doing things like covering Care for Kids parent fees for families on Care for Kids we tell parents this is for 6 months because we know so many of those families that have lower incomes and qualify for care for kids are the ones hardest hit by the pandemic. So that's sort of an equity help. We have been spending more money on staff family childcare networks at this time to support family childcare homes. We don't know if that money will continue, but we know we're building strong networks and that we will be developing a longer term plan, child screenings as well. So we're putting additional dollars into behavioral health supports for childcare programs. We know that right now families and children are struggling with mental and emotional health challenges. And so we may not be able to continue that, but we believe that these investments are investments in, if you will, infrastructure as we're training early childhood professionals in behavioral health supports for families and children in a big way for 2 years that we believe, and we're doing that in collaboration with DCF as well. So we're working the dollars to go with us and DCF to providers to support children's emotional health. So some of them are one-time things, but even those, we're trying to have the lens of how does this make long-term difference in our early childhood system in Connecticut.
We appreciate that answer. Any other questions from the committee? Seeing none, please move on to the next question.
The next question is clarification about the timeline and getting the $276 million out. There was a conversation at this committee about, having a very short time frame to get the dollars out. The grant stabilization part of the American Rescue Plan signed by President Biden has those dollars have to be obligated by September of 2022 and liquidated by September of 23, but 90 days, and I think this is what Representative Walker was speaking to, 90 days from the bill signing, Connecticut will have to report to the Administration for Children and Families if they have not obligated half of those grant funds. So they want us to make sure there's a plan and an obligation that the community, the state knows about for 50% of those funds. And then the other, so that's a grant stabilization. There are two parts to this grant. The other part has to be obligated by September 23 and liquidated by September 24. The other part of the grant just funds our CCDF program. So that all goes through the same rules in terms of care for kids and supporting families with childcare and supporting providers with rates, et cetera. So that's the timeline. I'm happy to answer questions about that.
Any questions from the committee? I don't see any, so we can go on to the subcommittee.
Okay. The federal relief funds to support birth to 3, I think the short answer is we want to find ways to help with family participation fees, but we need to we're waiting to hear from the feds about what the rules are about those additional funds. It's nowhere near as big as the funds that are coming to childcare or to education, but we will let you know. Anything we do has to go out to public comment with birth to 3, so that would be a very public process. Number 8.
Are there any other? Are there any other pockets of money or grants that you've had that are similar that you can give us a sort of outlook as to what you think the answer would be? If you would have
be a little more, can you repeat that? I'm not sure I understand.
Are there any other federal funds that you've received that are similar that may give you a insight as to whether or not you will be able to use those funds?
Yeah, I would say the outlook is we can use every penny of these funds in Connecticut. They're there to help our small businesses, childcare businesses, and they're there to help families. And the governor's been really clear that we need to think big and think about how we can help families that have been struggling and do it with an equity lens and also cross-agency. So we're also working with DCF and DSS and other agencies to make sure we're leveraging all the dollars for a more cohesive system. So we'll be able to spend the dollars. We have to wait for the rules, but we know the rules are going to be focused on childcare businesses and families, basically, and quality.
Thank you.
The next question was foster parents and care for kids, speeding up the payment. We are definitely working on this with DCF. It's something we both know is important for childcare providers and for families. So we are working closely with DCF on that. And then the last question just answers changes in available childcare over the past year. And you can see that during COVID, we were down to 56% of family childcare homes and 28% of centers open at the peak. And by March of 2021, we have 81% of family childcare open and 82% of childcare centers open. And that's those are the last two questions, which I'm happy to answer questions on. I just thought I'd fly through those so I know your time is tight.
Absolutely. I thank you for that. And are there any questions from the committee? Well, then I'd like to jump in for a second. I know that we spoke in the hearing about the outlook for enrollment, and the governor's budget reflects that enrollment's going to be down not only for next budget year, but the budget year after that for 2023. And I am wondering what the outlook has been in terms of where you think you're going to be with serving families and what the need might be there. Meaning, how many families did you serve during COVID? And what is the rate as to which enrollment has been increasing coming out of the pandemic?
Well, that's a great question. I just want to say that school readiness and CDC and Care for Kids, which are the way that we fund the vast majority of children. So that's about 15, 16, about 40,000 children that we touch in any given year. Those are the three biggest ways that we reach families. And we have, those are funded, fully funded, which means there's enough funding for the existing caseload. So we may have been low this year, but what we tried to do is we paid programs by classroom instead of by child. We gave a 25% enhancement to try to make up for some of the lost revenue with the state dollars. So we did try to maximize the state dollars, even if enrollment was down, so that we didn't lose those programs, and also so they weren't punished for the impact of COVID. I think what you're talking about is the Head Start,
Yes.
the cut to Head Start. So of those 40,000 kids, that's flat funded. For the state Head Start, that is a reduction of some of the extensions. I'm trying to look at how many children. So in 21, there were 220 new spaces that added capacity to federal Head Start, and 911 extended day, extended year. So that's about, it's a little over 1,000 slots where there was a reduction, but the 40,000 spaces were fully funded by the governor. Even though we expect caseload will be down a bit, we know that those programs are going to rely on us. So anyway, I just wanted to clarify in terms of overall, we're almost fully funded with the exception of the cut to the Head Start extended day services.
Thank you for that answer. Any other questions from the committee? Mr. Co-Chair, you're muted. All right, well, I don't see any other questions. I thank you for your time. I know that we're gonna have a lot to dig into based on today. And I know that Representative Walker, while she couldn't be with us, is going to have a lot of questions on her own. So
I look forward to those.
A lot of.
Great to see everybody.
Commissioner, I got your response.
Yeah.
Real quick, I got your email. I think we're gonna work. I think we're gonna move that bill to the floor. I don't think it has to go to finance. I did get your text,
Okay.
but I'm working on that for you.
Okay.
I just want to let you know.
Thank you.
All right.
Thank you.
Thank you.
Senator.
Thank you also.
All right. Bye-bye.
Thank you, everyone. I think this was a good meeting. Oh, who is this? Sorry, I just heard my own voice and it startled me. But thank everybody for being here. Mr. Co-Chair, would you like to say anything in closing?
No, I would just say thank you. I think we're going to meet again on Friday. Do we have another meeting Friday?
We have a meeting on Friday with SDE
and SDE
State Library.
And where else? And who else?
I think State Library as well.
Library. Okay.
That's
Same time.
correct. That's
All right.
correct.
Same time.
No, sir.
Thank
What
you.
time?
Friday's at 3 o'clock start time.
Friday at 3 o'clock.
Mm-hmm.
Okay. All right. No problem. Thanks a lot.
Okay.
All right. Thank you.
Bye.
Thank you, Madam Administrator.